Today, I am diving deep into 10 potential side effects that patients often experience on their IVF journey. And this is due to medications and the intensity of the experience. And here are more than 10 ways also to support yourself with natural medicine if or when you experience side effects due to IVF medications. And stay until the end where I add in a bonus side effect that I think is actually the most important one to look at and the most overlooked side effect out of all of them. So for many women, these medications are a necessary part of the journey to parenthood, yet they bring along some seriously challenging side effects. So let's look at how we can address these naturally with a touch of science to back the approach. Number 1, bloating and digestive discomfort. So this is a side effect that many women are familiar with during menstrual cycles. And this is because hormones being used to stimulate egg development are the same ones involved in regular menstruation. They're just present in larger quantities during fertility treatments. This can be incredibly uncomfortable. So many women do experience bloating during hormonal changes that are caused by medications and during IVF. And research suggests that a diet rich in fiber can significantly improve digestive health. So integrating fiber-rich foods like chia seeds, berries like blueberries or strawberries, and legumes into your diet, all of this can be a natural way for you to help. And staying hydrated helps reduce bloating and supports kidney function, which is essential because your body is processing all these medications. A study published in the Journal of Human Nutrition and Dietetics emphasized the role of hydrating in improving gastrointestinal function. So definitely drink water. And I always tell people, and again, check with your doctor on all these recommendations, but drinking half your weight in ounces. So for example, if you weigh 150 pounds, you're aiming to drink 75 ounces in clear, purified water. Next up is mood swings. So hormonal medication might cause emotional changes like mood swings, which would cause irritability, restlessness, or a general feeling of being down may occur while taking these medications. Again, I will defer to a regular daily meditation practice. And I teach these in my online fertility group. So message me below. I'm happy to send you a fertility meditation that I wrote and recorded myself. And I use this often with patients and clients in the program. There's also an adaptogenic herb like ashwaganda. There's actually a number of herbs that you could take that have been studied for their potential use to stabilize stress response. And a systematic review in the Journal of Alternative and Complementary Medicine found that ashwagandha had a positive effect on stress and anxiety. And mindfulness and controlled breathing exercises can also be excellent tools, as noted in research from the Journal of Clinical Psychology, which highlights the benefits of mindfulness on emotional regulation. So you have a ton of options. It's finding the one that works for you and finding the one that, okay, I can add this into my everyday, not just when it happens, because we'll benefit more if we do meditation preventatively, or when you first wake up in the morning, that's when you do it. So again, comment below. I'm happy to share a meditation with you. It's recorded and I can send it over to you. Okay, number 3, we're looking at soreness and bruising from injections. Now, local reactions at the injection site can be really uncomfortable. And you can get bruised, you can get swollen, and it can take a few days to go away. But as you're doing more shots, you can reduce the side effect by choosing different sites. I know, it's just moving and moving, but it's not really addressing the actual issue. So topical applications of aloe vera, that can be really soothing. It can provide relief. It can be cooling. Also, Arnica is widely used for bruising and is supported by research in the European Journal of Pharmaceutical Sciences, which found that Arnica can help reduce bruising and inflammation, which is exactly what you would be dealing with. And I recommend to my patients and clients CBD topicals They usually come in gel form or like a roll-on form. But again, check with your IVF nurse and doctor just to make sure, because some doctors are not cool with that. Okay? I'm not your doctor. They are. They make that choice. But I can tell you that it really helps with blood circulation and pain. And in case you don't know me, I'm Dr. Gina Terinoni, and I've helped over 2,000 women and couples to become pregnant and have healthy babies. And I would love to help you too. Everything on this channel that I've written is based on what I have used to support my patients and my clients over 22, 23 years now in my clinic. And it's worked, and it's helped them to become pregnant and to become moms. So please do me a huge favor. I would really appreciate it if you would subscribe today. And if you want to get notifications, hit the little bell. That notifies you when I drop new episodes every week. I do a couple long forms a week. I do a lot of shorts, but I also go live weekly and I answer people's questions. So you can put them below or you can DM me on Instagram. I'm happy to answer your questions there. Or if you just want to comment below and request a specific topic for an upcoming episode, that would be wonderful as well. Okay, let's get into number 4, headaches. This is probably one of the number 2 side effects that my patients come in and want help with. Headaches may occur due to hormonal shifts in your body, due to medications, but I would say due to stress. This is a lot. Being on your IVF journey is like a part-time job with not a guarantee. So there's a lot of moving parts and things happening emotionally, physically, energetically. So for headaches, hydration, it's a simple yet effective remedy. Additionally, magnesium, you can get that in foods like in almonds and spinach and pumpkin seeds. All of these have been recognized for headache relieving properties in a report by the American Headache Society. But I would also say there's very specific like acupressure points or massage points on your hands, on your feet. I'll cover that in another episode. Deep breathing exercises. Again, when you're having the headache, you can do that. If it's something more like a migraine, you're going to need something stronger than that. But there's tons of things that you can do. Deep breathing, deep belly breathing exercises, not forceful, just like inhaling, exhaling, and do that for 5 or 10 minutes. Try to get some fresh air, get outside, nice deep breaths. Number 5 is fatigue. Fatigue can be a side effect of IVF and medications. And again, this is due to hormonal shifts caused by fertility drugs and other physical symptoms like hot flashes can also interfere with sleep. And of course, that's going to lead to fatigue and tiredness. And fatigue is a common side effect that can be managed by prioritizing good sleep hygiene. And also, so we're talking about 8 hours minimum if you're trying to get pregnant, but I swear everybody should get at least 8 hours. But you're looking at quantity of 8 hours or more, or 8 hours at least, and then quality of sleep. So good hygiene is no blue screens like computers and phones and right before you go to sleep, because that keeps things active and you don't go into a deep sleep that way. Also, eating a balanced diet that can stabilize blood sugar levels, that's helpful for sleep. The National Sleep Foundation emphasizes the importance of sleep for overall health, particularly during times of stress. Okay, and then supplementation with coenzyme Q10, CoQ10, has been researched for its potential to improve egg quality and overall energy levels. And that was cited in Fertility and Sterility magazine or journal. Vitamin B12 is also another nutrient that plays a pivotal role in energy production and can be a useful supplement as per research in the Journal of Human Nutrition and Dietetics. So here's the good news. You have all these options. I'm giving you a ton. Save this episode. If you have that experience, then come back to it. And again, reach out to me. I'm happy to help you. And now, while all these natural remedies are based on research and traditional use, it's vital to remember that they complement and they don't replace the advice of your healthcare provider, your doctor, your IVF nurse. Always ask them, especially when going through IVF. Number 6, nausea. So another physical side effect of IVF can be nausea. And some women do also have vomiting, but not always. I don't see that a ton in my clinic. Ginger, grated ginger, sipping on ginger tea. They have ginger chews, but they have a lot of sugar in them, but whatever. It's just for once in a while, but I would do grated fresh ginger. I don't like the ginger tea bags as well because the quality tends to be really low. So always try to do fresh, and that'll settle your tummy. Also helps with circulation, also warms the body up. So that's always good. Can help with your immune system as well, which you definitely need to keep up. And then with nausea, you also want to keep your head raised a little bit while sleeping. So you can put an extra pillow, or some people will put blocks or bricks under the headboard, those feet. So you can do that and just go up a couple inches. That can really help immensely. And then also, of course, I always say, get outside, get into nature, get fresh air, take slow walks, deep breathing. Okay, next up is number 7, breast tenderness. So very similar to a menstrual cycle, you can get breast tenderness with fertility drugs. The sensitivity can be mild, moderate to pretty intense. So ways around that is, if it's comfortable, you can warm up with a hot water bottle or a heating pad just for a little bit, like 5 minutes or something. Don't light and sleep with it. And then you can do just like light breast massage with very clean oil. So organic, unscented. I would just go basic, but just to help with like circulation in the area. Okay. Number 8, allergic reactions. Some women have allergic reactions to the injection. So not just pain, but they might get like skin itching or redness or rashes, that kind of a thing. What I like to recommend for that is they have those little muslin or like tea bag, like the little enclosures. Some people, if you don't have that, you can use a coffee filter, but you can put dried oats in there, and then you can steep that in a mug of boiling water and make the water nice and milky. And then you can keep that bag, and then I'm using my hand, but do it at the injection sites. And then you can hold the oat pouch on there, and that can take the itch away and the inflammation. So I highly recommend that. Number 9 is mild pelvic and abdominal pain. So during and after the egg retrieval, this is obviously beginning step of IVF, you can have mild to moderate pelvic and abdominal pain. And some women say it's similar to cramping that they have during their menstrual cycle. So usually this pain can be mild enough. You ask them, they'll probably recommend over-the-counter medication. But of course, I'm like, you're on enough medication. So try your best. There's certain teas that you can sip on. Again, I would go with ginger, adding in licorice teas, and sip on that throughout the day. That can help extensively with cramping. Also, hot water bottle again, or a warm pad. But again, like not longer, in this case, like not longer than 10 or 15 minutes. Don't sleep with it on, but do it on and off, maybe 3 or 4 times a day. And again, like you can do mild massage as well, but take care of yourself. You address all these things. Don't just deal with it. Number 10 is pelvic infection. So pelvic infections, that is a risk with egg retrieval, and they're rare. I've seen some patients have them, but some doctors will even give antibiotics before and after prevent that. But not every doctor is the same. I've worked with several doctors and supporting their patients. So it just depends. It can come up, but this is another reason to be like eating really healthy on the fertility diet. I give a specific IVF diet in the next video. So definitely subscribe and stay tuned for that. Getting proper sleep, working on stress reduction, all these things. If you keep your immune system up, then infection risk goes down. So definitely. Okay, so we're at the bonus. This is the hardest one, I think, and it's just overlooked. People don't want to deal. I don't even mean patients or clients. I feel like it's more medical professionals. We're doing this, we're doing IVF, we're retrieving eggs, or other things. And really the missing piece of all of this is the emotional stress and the emotional impact that it has on you for a long time, right? It's when I talk to my patients and my clients, if it works in one cycle of IVF for several months, you might be anticipating leading up to even starting. And then there's the stress of all the appointments. And then there's the anticipation of the results. There's so much stress. And if there's not every cycle ends with a pregnancy. So there's mental preparation, or if someone experiences a miscarriage, there can be a lot of buildup and tension and inexperiences on these fertility journeys and these IVF journeys. If you don't get pregnant after a cycle, it can be terribly disappointing because you've expended, and your partner, you've expended so much energy, time, money, disappointment, sadness, grieving. All of this needs to be addressed, and you need to be supported in the proper space. And then there is a study in the American Society for Reproductive Medicine points out, while IVF does not increase the risk of miscarriage, pregnancy loss after going through an intense process might even be more painful. So there's a lot to consider. I wish you well on this journey, and I run an online community. Consider joining that community because I support you in so many ways, including emotional support. And we have meditation groups, and you can do them on your own. You can join the lives. There's a ton of support in there. And again, just a reminder, all these natural remedies are based on research and traditional use. It's vital to remember that they complement, I don't replace the advice of your healthcare provider, your IVF doctor, your IVF nurse. Always ask them. Again, especially during IVF. In the next video, I will walk you through the exact fertility foods to use as your IVF diet in the prep in the months leading up. So subscribe so you get notified. Thank you so much for watching, and I'll see you soon.